Hi, this is Lexi, the Wellness Coordinator at St. Francis Hospital. Today for our Renew session, we're going to take 20 minutes to go over breathing exercises that you can use when you're feeling yourself get a little bit anxious, and also chair stretching, things that you can do throughout the day in your chair if you're working, or if you're a nurse, if you're charting, whatever it may be. So, I'm just going to read a little write-up that I have on abdominal breathing versus chest breathing. So abdominal breathing is a type of deep, even breathing that engages your diaphragm and allows your lungs to expand and create negative pressure that drives air in through the nose and mouth and filling your lungs. You're probably using this pattern of sleep when you're in a relaxed stage of sleep. On the contrary, chest breathing is a type of breathing that comes from the chest and involves short, rapid breathing. When you're anxious, you might not even be aware of it, but this is probably how you're breathing. An easy way to determine this is to place a hand on your chest and a hand on your abdomen and just simply breathe and feel where the movement is coming from. Now, I know that when you're feeling anxious, this is the first thing that you're going to go to do. So the purpose of these breathing techniques is more just to have a tool in the back of your mind to turn to when you're feeling yourself get a little anxious, and it brings your heart rate down, your blood pressure down, slows your breathing by doing these exercises. So I have 3 that we will go through together. The first I'll explain, and then I'll leave time for us to just go through the technique at our own pace. So the first one is 5-5-5 breathing. And you will start by breathing in through your nose for 5 seconds, hold the breath for 5 seconds, and breathe out through your mouth for 5 seconds. So we'll do it once together, and then I'll leave room for us to do it by ourselves for about 1.5 minutes. So together. Now we'll go at our own pace for about 1.5 minutes. You can close your eyes, open your eyes, do a little bit of meditating while you do this, or just simply stare ahead and do the technique. Okay, and we'll finish up our last breath. And next we're going to do alternate nostril breathing. So I'll kind of describe it and then show it. You're going to be having your hand like this and use your fingers like this to close up one nostril. So you're going to inhale and exhale normally, and then close off your right nostril with your thumb and inhale through your left nostril. And then you're going to close your left nostril and exhale through your right nostril, and then inhale through your right nostril. And again, exhale through your left, and then inhale. Exhale, inhale. So we'll do it a few times together, and I'll kind of be speaking through it, even though my voice is going to sound weird, just so you guys can get a feel for it. And then we'll do another like minute and a half of just doing the technique on our own. So start with the inhale, exhale on our own, and then block the right nostril. Inhale through the left. Cover the left nostril. Exhale through the right. Then inhale through the right nostril. Cover the right nostril. Uncover the left nostril. Exhale through your left nostril. And inhale through your left nostril. Switch fingers and nostrils and exhale through your right and then inhale. Okay. I will leave a minute and a half of time for you to go through this breathing technique on your own. Okay, we'll take our last breath in this technique, and we'll move on to the last technique that I have for you guys. It's called belly breathing. You can do this in a seated position or a lying position. Either will work. I find it easier to, excuse me, feel the belly breathing from a lying position. That's just me though. You can kind of play around with it, and I'll give you 2 minutes this time to just do the technique on your own. So that you can kind of feel around with like sitting versus standing. But essentially what it is what I was talking about, what I mentioned before with holding one hand on your chest and one hand on your stomach to feel where the breathing is coming from. It kind of is just as simple as that, and just focusing on having the hand on your abdomen moving and the hand on your chest not. So as you inhale through your nose, the air as it moves through should rise your stomach, and your chest should not be moving. And it's easier said than done, actually, at least for me. I'm curious to hear what you guys have to say, but if you you have to take a deep breath, and especially if you're going through your nose, you have to focus on it, and you have to consciously focus on really taking a deep breath, because a deep breath is the only breath that is going to make your abdomen move. Like I said before, those shallow breaths, they come from your chest. So taking these deep breaths in through your nose and out through your mouth at your own pace, and feeling your stomach, your abdomen move up and down with your inhales and exhales, and no movement in the chest is what this exercise is for. There has been studies done, and the American Institute of Stress said that 20 to 30 minutes of belly breathing can significantly reduce stress and anxiety. So I have been trying to implement this within my personal life, just like before bed. You know, that's where I find it to be the easiest way or easiest area to implement into like daily life. But again, you feel yourself getting anxious sitting at your desk, just do it for like 2 minutes if you have 5 minutes. But if not, anything will help by you're slowing down your breathing. You're taking deeper breaths, which in turn is going to slow down your heart rate, lower your blood pressure, and even just having that moment to yourself to just decompress for 1 second. You take 2 minutes, you're focusing on your breathing. Work is just set aside for 2 minutes, and then you're going to feel more refreshed, more relaxed, and ready to take on your next meeting, your next project, whatever it may be, your next patient, if you're a nurse. So we'll do a few breaths together, and then I'll leave 2 minutes for you to practice this on your own, and you can practice sitting and lying. Okay, I'll leave you guys 2 minutes to continue on. Okay, we'll take our last breath in that technique. And just a little side note, if you're feeling lightheaded or dizzy doing any types of these exercises, obviously just take a break from them. Like the nostril one, it's a little bit more common to start feeling lightheaded or dizzy doing that. So you kind of just have to know your body and feel out what's best for you. If after a minute it's harder for you, it's a little, you get more lightheaded and dizzy, then maybe just 30 seconds is all you really need. And then maybe try the belly breathing exercise or the 5-5-5 exercise after that if you can't tolerate doing it for much longer. These can be put together, used just once, used for 30 seconds, used for 30 minutes. It's truly whatever you need, whatever your body tolerates, whatever your body is telling you it needs. So it looks like we have about 5 minutes left. I'm going to do a little bit of desk yoga, which I think is super fun. I'm just trying to move this table back a little bit. Okay, perfect. Sorry if that made you dizzy. So first we're gonna start with chair cat cow. So like normal cat cow, you're on all fours and you put your spine up in the air and then arch your spine. And it's kind of that same thing. So with your inhale, we'll inhale and do a cat position. and exhale into a cow position. And we'll just move through that a few times at your own pace. You can have your arms on your knees or on your chair rest or on the bottom of your chair. Okay, and next we're going to just do a little twisting. So we'll take our right hand and place it on the left part of our chair and place our left hand behind our chair and twist. And same thing on the other side. And just finding the hand placement that works with your chair, essentially just getting some type of twisting motion in the lower back. We'll move through that at our own pace for a little bit. Okie doke. And next, we are going to do like a reach over. So we'll start with our left hand up in the air, and we'll just, if you need to put your elbow on your armrest or hold the bottom of your chair, whatever is more comfortable to you, just reach over, feet flat on the ground this whole time. Switch sides. Then you can move through at your own pace. And then next, we're actually going to stand up out of our chair and use the back of it to do some leg exercises. So we will, this isn't the best camera wise, sorry. We will place our right leg forward and bend forward. This will be a hamstring stretch. And the same with our left leg. Bending forward just until you feel it right here. I'm not the most flexible, so if you find yourself going further than this, that's probably normal because I'm not flexible. Then we'll put our feet together and just lean over the back of our chair, stretching our back and our hamstrings. Come up, and while we're standing, I'm just gonna sit since I'm like out of the camera now, but while you're standing, you can move your neck one side to the next. Up and down. And we'll move our wrists and our ankles Since we're standing, we can be doing our wrists in one ankle at a time. Switch. Okie doke. At that, I hope you feel renewed, ready to take on the day. Again, as always, please reach out if you have any questions, any ideas, any comments at all. Everything is always more than welcome. My email is alexa.tremble@alina.com. Have a great day.